Okay, so let us continue our discussion on serology. So we are now on the serological tests used to diagnose diseases. And the first diagnostic test on your handout will be the first disease that will be discussed based on your handout would be the syphilis. So before we discuss the different laboratory techniques used for the diagnosis of syphilis, let us first have a brief description, or it's a brief discussion on syphilis as a disease in general. Okay, so syphilis. So syphilis is actually one of the most common STIs. So when we say STI, it means sexually transmitted infection. We do not use the term STDs anymore nowadays. We call them STIs. So syphilis is one of the most commonly encountered STI in the laboratory setup. So from time to time, we always receive requests for RPR and VDRL. So we only do screening. Confirmatory tests are performed on more or in more advanced laboratories. Some of them are actually being sent into the National Reference Laboratory for immunosero in order to confirm for the presence of syphilis. But syphilis is not actually that much of a big deal compared to HIV. Why? Because we can actually not treat, but syphilis is it can be managed well compared to STI. Compared to HIV. What am I saying? Compared to HIV, maybe one of the reasons is because syphilis is caused by a bacterium and HIV is caused by a virus. We all know that a virus is an intracellular parasite. So being an intracellular parasite, it's actually a challenge to manage intracellular parasites over bacteria that are usually present on the circulation in general and not inside cells. Okay, so syphilis is actually, it has a lot of other names. So it is also, it has other names. So some of which are great pox, it's also called as the great pox, and the Spanish disease. Spanish disease. It's also called as the French disease, the evil pox, and the Italian disease. So actually, based on this, we can say that syphilis may be the first breakout of syphilis happened somewhere in Europe because of the name Spanish pox or Spanish disease, French disease, and Italian disease. So most of the countries associated with syphilis, the first cases of syphilis were actually European countries. I don't know, maybe it has something to do with the mode of transmission. We all know that they are more active in that particular aspect than Asians. Well, I hope so. So syphilis is caused by a bacterium known as Treponema pallidum subspecies pallidum. So the cause is a bacterium T. pallidum subspecies pallidum. So when indicating for the cause of syphilis, it is very vital to indicate subspecies pallidum. Why? Because there are also other T. pallidum bacteria that can cause diseases other than syphilis. So it is very important to indicate which subspecies is the cause of which disease. Because, for example, we have the T. pallidum subspecies pertinu or pertinue, which is the causative agent of yaws. We also have the T. pallidum subspecies endemicum, which is the causative agent of Begel. And then we have the T. pallidum subspecies caratium or caratium, which is a causative agent of your pinta. So, C, we have T. pallidum, subspecies pertinue, subspecies endemicum, subspecies carachim. So, it's very important to indicate subspecies pallidum when referring to the causative agent of your syphilis. So, for syphilis, I mentioned a while ago that syphilis is managed better compared to HIV, and we also have actually circulating drugs or medications used for the treatment. So these drugs are used for the treatment, not management. So when we say treatment, this can actually completely eradicate the presence of syphilis or the presence of the T. pallidum, subspecies pallidum in our circulation. So for the treatment, we can use heavy metals, one of which is your arsenic. So we can use heavy metals, one of which is your arsenic. So arsenic is actually incorporated in arsyphenamine, and also salvarsan, and also 606. So these are some of the medications incorporated with arsenic that are used for the treatment, or that are used in the treatment of syphilis. And another is a famous antibiotic, which is your penicillin. So please take note that penicillin is actually the drug of choice for syphilis. So it is the drug of choice. So penicillin is a drug of choice for syphilis. Okay, so how do we usually acquire syphilis, or what are the different modes of transmission of syphilis? So acquisition of syphilis. So first, which is the most common mode of transmission, would be your sexual intercourse. The second would be through parenteral transmission. And third would be vertical transmission. Okay, so when we say parenteral, what does it mean? So this refers to acquisition through contaminated blood and contaminated needles. So take note, this is actually one of the reasons why, if you remember from your blood bank class, that we also screen for the presence of syphilis among our donors. We test for RPR as part of the screening tests to make sure that the blood to be transfused is actually safe for transfusion. So please take note that T. pallidum in general, it actually dies if blood is refrigerated for 3 days. So T. pallidum dies if blood is refrigerated for 3 days. So actually we can say that, we can just say na if the blood is positive for syphilis, why not just refrigerate it for 3 days? Diba? To eradicate T. pallidum. But just take note that there are physicians who would request for fresh blood. So when we say fresh blood, they should be less than 5 days old. So when we say less than 5 days old, you have fresh blood. So fresh blood, less than 5 days old. If I'm not mistaken, this is based on the Philippine Red Cross standards, or in some other cases based on the blood transfusion committee of the hospital, on how they would consider a blood as a fresh blood. So 5 days old. So isipin nyo, if we collect blood today, what will happen? The screening test would usually take, let's say, 1 to 2 days. So for the remaining, if you're going to say we need to refrigerate the blood for the next 3 days, it will not be considered as a fresh blood anymore. So to be safe, we do not, as if it is positive for RPR, we immediately discard the blood. We do not take a risk and refrigerate it for 3 days and then saka mo ibibigay sa pasyente, sasabihin mo na ay patay na po yung T. pallidum dyan, kasi theoretically speaking, T. pallidum dies if blood is refrigerated for 3 days. So we cannot do that. Last would be the vertical transmission. So when we say vertical transmission, this refers to mother to fetus transmission. And this is actually the mode of transmission for your congenital syphilis. So congenital syphilis happens when the mother is actually infected, and because T. pallidum is a minute organism, it might traverse the placenta and enter the circulation of the baby. Or when the baby passes through the vaginal canal of the mother during delivery, it might induce introduction of the syphilis into the circulation of the fetus. So congenital syphilis, again, as part of your review, is actually characterized by what we call Hutchinsonian triad. So characterized by your Hutchinsonian triad. Sorry, dili klaro ako ang sulat. So it's Hutchin, Hutchinsonian triad. So when we say triad, so there are 3 characteristics associated with the Hutchinsonian triad. So when these 3 are present, we can make an assumption that the baby might be suffering from syphilis, or these 3 are actually the adverse effects, but the physical manifestations rather. These 3 are the physical manifestations of congenital syphilis. So first, we have notched teeth. Notched teeth. Okay. So when we say notched teeth, so diba, the tooth, the usual appearance of a tooth is like this. SpongeBob tooth. So when we say notched teeth, yung may mga daw buak-buak. Grabe yung pagka-notched teeth. No? Pero something like that. Okay, so the second would be keratitis. Usually presents as those scaly skin. So scaly ang skin ng may patient na may keratitis. And we have deafness. Okay, so these 3 are what we call the Hutchinsonian triad, and these represent physical manifestations of your congenital syphilis. Okay, so I guess that's enough for a brief introduction on syphilis. So let's just discuss the stages of syphilis. So it is important to discuss the stages of syphilis because knowing them, we can have a general idea on what particular test to use so that we can detect for the presence of syphilis among our patients. So stages of syphilis. Okay, so stages of syphilis. So first we have the primary syphilis, the secondary syphilis, the latent syphilis, and the tertiary syphilis. So first, the primary syphilis. So don't worry, we will have a very thorough discussion on syphilis, primarily the pathogenesis and the life cycle of syphilis during our discussion or during our schedule in Bacte. So the primary syphilis is actually characterized by the presence of hard chancre. So hard chancre is a painless and firm lesion. So please do not confuse hard chancre with your soft chancroid. Iba yun. So soft chancroid, from the name itself, it's soft, and this is actually painful. And it is caused by the what do you call them? Fastidious organism, your H. ducreyi. So Haemophilus ducreyi is the causative agent of your soft chancroid, which is painful and soft. So it is the opposite of hard chancre seen in primary syphilis. So second, we have the secondary syphilis. So secondary syphilis. So the secondary syphilis is characterized by the lesion called condylomatallata. It is a wart-like lesion seen in moist areas of the body. So it is wart-like lesions in most areas of the body. So the presence of condylomatallata actually indicates dissemination. So it indicates dissemination. So when I say dissemination, this refers to the invasion or the, what you call this? When we say dissemination, nagakalat siya, it conquers other body organs. It conquers other body organs. Spread, yun, the spreading of the bacterial particle to other organs, invading your other organs and causing infection or causing damage. So third, we have the latent syphilis. So when we say latent, it is like a window period. So as we all know, when we say window period, there's actually the absence of clinical symptom. So please take note that it simply refers to the absence of clinical symptom. It doesn't mean that the bacterium is not present in your circulation. So unless before that, we have the tertiary syphilis, which is characterized by gammas and neurosyphilis. Okay, so gammas, these are lesions. However, the content of the lesion or the gammas contain dead organisms. So the gammas contain dead organisms. So therefore, we can say that in the presence of gammas, we should not use the direct method of syphilis detection, which is microscopy, because the organisms are actually dead. So if the organisms are dead, we cannot efficiently identify their presence, since in direct detection using dark field microscopy, we detect for the presence of alive motile spirochetes. So if they are dead, it the accuracy of the test itself will be in question. And we have the neurosyphilis. So for the neurosyphilis, of course, our sample would be your CSF. So the CSF will be subjected to serologic tests or serological tests. So first, neurosyphilis. So we can say that there is actually complete dissemination of syphilis at this point, because the syphilis has already penetrated the blood-brain barrier. So in this case, if the patient is categorized as having tertiary syphilis, then it is like a full-blown severe case of syphilis. And another thing that I would like you to take note is serological test using CSF. So it is very vital. Usually when we say serological tests, we usually use plasma or serum most of the time. So it is very important because like what I said, in tertiary syphilis there are dead organisms, and we can use CSF rather to detect the presence of syphilis in the in the CNS. What is the meaning of CNS? Central nervous system, so as to diagnose neurosyphilis and syphilis infection. So based on this, we can say that it is very important for serological tests not to be applied or not to be limited to plasma and serum as their sample. So serological tests for syphilis must also accommodate other body fluids, so as to be helpful, especially in the cases of tertiary syphilis. Now, in latent syphilis, like what I said, it is also referred as the window period, and it is characterized by the absence of clinical symptom. Therefore, how are we going to, does it mean that the patient will not be diagnosed if the patient is at the latent syphilis stage of infection? Actually, we can still diagnose the patient through the use of serological tests. So serological tests can still detect for the presence of the syphilis or its proteins, so that we can still diagnose our patient as having syphilis and we can give proper treatment. So we can say therefore that the direct detection of syphilis is limited to primary and secondary syphilis because of the presence of the hard chancre and condyloma thalata. So please take note that the direct detection is actually preferred only in the presence of lesion, since in the lesion we can aspirate the lesion itself, and then we can subject it to dark field microscopy so as to detect for the presence of live motile spirochete bacteria. So I guess that's it for the introduction of or for the brief discussion on syphilis. So now let us proceed to our discussion on the laboratory diagnosis of syphilis. Okay. Let me just get another piece of paper. Should I use blue? No, let me use green. Okay, so the laboratory diagnosis of syphilis. Okay, dyan, laboratory diagnosis of syphilis. So the laboratory diagnosis of syphilis, actually detection of syphilis, like what I said a while ago, detection is either direct or indirect. So detection is either direct or indirect. So when we say direct, this simply refers to the direct visualization. So direct visualization should I use brown? So this refers to the direct visualization of the organism. So refers to the direct visualization of the organism from lesions. Di klaro ang brown, no? So I guess it doesn't make any difference if I use black or brown. Anyways, when we say indirect, this refers to the immunological, or in this case serological methods. Okay, so for the direct, like what I mentioned a while ago, this we direct for the presence of the organism from lesions. So therefore we can say that direct is actually the preferred method during the early stages of the infection, or it is useful for the detection of the syphilis bacterium during the early stages of infection. So those early stages are the primary and the secondary, because in the primary we have your chancres, and for the secondary we have your what was that again? In the secondary, nakalimot ko, we have your condyloma thalata. Okay, so actually, according to the Book of Henry's 21st edition, condyloma talata is already manifested in cases of already manifested in early stages of congenital syphilis. So when a child is born with congenital syphilis, there are some who have already, or who do not manifest, or who do not manifest the presence of chancres. Instead, they already have condyloma talata. So we can say that when the baby is born already with secondary syphilis, bypassing primary syphilis. Okay, so the indirect method, since the direct method is used in the early stages of infection, the indirect method is used in the later stages. So based on our brief discussion a while ago, later stages, particularly in the latent syphilis and your tertiary syphilis. Okay, so let's continue. So the laboratory diagnosis of syphilis. So first, the direct detection of syphilis. So microscopy. For the direct detection of syphilis, we utilize a special microscope called your dark field microscope. So we use dark field microscopy. What we usually use in the laboratory is our bright field microscope, or we utilize a technique, bright field microscopy. When we say bright field microscopy, the element or the organism appears dark against a white or bright background. Hence the name bright field microscopy. So the field of vision is bright or white, and the element or organism appears dark against it. So that is actually the opposite of your dark field microscopy. So in dark field microscopy, the background is dark, and the element or organism appears light. Doesn't make, parang it sounds wrong, but that's the idea. The element or the organism appears light. It doesn't really sound right. Wait, let me reflect on this. What should be the best term to use? Ano ba? It appears light against a dark background, or it appears bright against a dark background. I guess kahit papano I think it sounds correct. White. Okay, the Book of Henry's stated that it is white, or we should see white treponym against